Welcome to Health Literacy Out Loud. I'm Helen Osborne, President of Health Literacy Consulting, founder of Health Literacy Month, and author of the book Health Literacy from A to Z. I also produce and host this podcast series called Health Literacy Out Loud. It focuses on many aspects of health communication, patient education, and health literacy. Today, I'm talking with two guests. Adena Dacy is a speech-language pathologist. For many years, she worked with people of all ages who have communication disabilities. Adena now is an associate director on the healthcare services team at the American Speech-Language Hearing Association, otherwise known as ASHA, ASHA. Her areas of interest include health literacy and access to quality care for people with speech, language, voice, hearing, and/or cognitive difficulties. The other guest is Judy Crane. Judy had a long and successful career in medical services and sales. But her work was abruptly cut short when Judy suffered a dissected aorta followed by a stroke. One of her residual effects is post-stroke aphasia. Judy is now an active advocate for people with aphasia and serves on numerous committees and programs as a patient advisor, volunteer, and staff member. In 2021, Judy was awarded the Stroke Survivor Hero Award by the American Stroke Association. Welcome to Health Literacy Out Loud to you both.
Thank you so much, Helen.
Thank you very much.
I really appreciate your invitation, I have to say, to be here, and especially to be here with Judy about this topic that she and I are both so passionate about. So thank you for having us.
Oh, this is great. I'm looking forward to our three-way conversation. And it's all about communication disabilities. Let's start from the beginning. When you use that term, what does that really mean? Communication disabilities. And Adena, maybe you can get started with this, and Judy, you're going to be adding to this as we go along.
Sure, I'll start from the speech-language pathologist perspective. I think many people live with speech, language, voice, hearing, or as you mentioned, Helen, cognitive difficulties, and those can affect their ability to communicate. I think especially when the environments they are in have barriers to getting and receiving information in ways that work best for them. And I think that's really sometimes where the disability part comes in, when they don't have access to that information in the ways that work best for them. So when we're talking about people with communication disabilities, they may have trouble hearing or understanding information in conversation. It might be challenging for some of them to read or write, or I think as Judy will share, they can have problems finding their words or using their voices, forming sounds fluently.
Yes, Judy, take it from there. What do you think of when you think of communication disorders or communication disabilities?
Well, first of all, I was in medical sales, so my voice was my career.
Right.
And all of a sudden, when that's ripped away from you, and what it made me feel like, I know exactly what you want to say, but the words wouldn't come out right. Or sometimes initially I had significant aphasia. So I wasn't able, sometimes I would keep talking thinking that I was making sense, and it wasn't making sense. Nobody could understand me. And that was so frustrating.
Judy, as we're recording this right now, and we're in 3 separate locations, each one of us, I have the treat of being able to see each of you, but that's not part of our audio-only podcast. When you said, I know what I wanted to say, you kind of tapped your head, like, I have the words in there. And when you said you had trouble, you pointed more to your mouth. Is that there's just a disconnect through this stroke, a medical situation, that the words in the brain don't come out the way you want them to?
Yeah, sometimes it's like the highway between your brain and your mouth. It's broken. And so sometimes, you're finding ways around to help you to get the word out, I use a lot of my hands. Sometimes when I am trying to say something, if I'm amazing, first of all, it's almost like I have a short circuit in my brain.
Okay.
I also, lots of times I talk to people about, it's like my brain is like Swiss cheese, where I'm talking and I'm getting my words out, and then all of a sudden I go into a hole and I'm trying to find a word and I can't get back up in order to continue that conversation. I get stumbled. Things get stumbled trying to get out. Does that make sense?
To me, it makes so much sense, and I just admire you. Adena suggested when I was going to do this podcast and we were doing our planning with Adena, we were moving along, and she said, how about we include somebody who has this communication disability? And she recommended you. So I so appreciate bringing in that first person story too. We're not just talking about people, we're talking with people. And if you find something hard in doing this podcast, I'll say it again. We'll wait a moment. Thank you. Adena, your work is all about making this communication a bit better. So tell us more about that.
Yeah, I think one of the other things I think that's important to point out in working as a speech language pathologist to make communication more accessible for people is that we're working with people across the lifespan. So Judy's an example of someone who has a communication disability that's acquired from something like a stroke, or, working with someone who might have a brain injury or acquire multiple sclerosis. And then we also work in childhood. Sometimes, people may have communication difficulties that are related to genetic syndromes or intellectual and developmental disabilities. So they may be born, or they're things that might develop more in childhood related to an illness. So there's kind of this developmental and acquired aspect to communication disabilities. And like I said, across the lifespan. So when we're working on accessibility, some of the strategies we use to maximize communication, and whether that's in the form of understanding what's being said, understanding what's being read, writing, or expressing through speech or sign language, what we do could differ depending on maybe the cause and at what age the communication disability came on.
I'm also thinking, hearing Judy's story too, that these things can change over time. Judy, your stroke, your aphasia was a while ago. I don't know if you're getting more comfortable with your communication, if it gets easier or if it gets harder over time. Adena, as you're talking about other reasons people can struggle with language or communication, I can think of some illnesses where it seems to be progressively worse over time. And are there times it can get better over time? Am I right in this, that it's not a clear-cut pathway about communication?
Absolutely. I think there's a variety of factors. One you mentioned is sometimes there are, maybe in the more acquired disability space, there's degenerative processes that happen in our brain, whether that might be something you may be familiar with, ALS or Lou Gehrig's disease. So
Right,
there we
yes.
may see, more deterioration of communication over time. In a case like Judy, often, people with aphasia, we see them improve over time. Same thing with some of the more developmental related disabilities. But I would say another piece that's important in the fluctuation or any change in communication ability is really the context of the conversation. So while Judy may feel, she said like over time, she's definitely improved, and her aphasia, I know, Judy, you've always often refer to it as like more mild now than when you first had it. I think sometimes the time of day, if someone's really tired at the end of the day, that can impact their communication and maybe make it worse. For some people, it's getting up in the morning. They just kind of need to get going and their motor hasn't gone yet. So for them, that could be something that makes communication more difficult or change or fluctuate.
Just kick on something that's always been a problem. I say mild because I'm clinically, I guess, been told that, but it's not mild when it's to the person that has it. Because as I tell people, they're not inside my brain. They don't know what goes on in there. And what I have to do to even do this podcast here, I have to do lots of prep for myself in order to do even an email. It takes longer. So the mild is it's a word actually I really don't like, but I am also here to talk from everybody that has aphasia, and I many of them cannot communicate the way I can. So I want to talk for everybody because a lot of them can't.
Thank you. Thank you. I'm also thinking another question that has to do with the role of technology. In order to do this podcast, we each needed to get on to this recording software in our own way. And we each had problems. Judy, maybe yours related to something about aphasia, but maybe not. Adena, you and we had a few little back and forths about some problems with that. When it comes to communication disorders, what about the role of technology these days? Does it make things harder, easier? I want to hear both of your impressions on that.
I would say it's a two-sided coin. There is definitely a wonderful place for what we call assistive technology in the world of speech-language pathology and communication disabilities. There are many apps that can support people in their everyday activities to do things. If they have difficulty reading, they can use screen readers that will read out loud for them. That's an example of a technology.
Okay.
We use something called augmentative and alternative communication systems. Those are the short version of that is AAC, and that's a technology that's been used for years with people with communication disabilities. And those technologies, and whether that be very low tech, like a communication board with pictures. If
That's what I was thinking of,
yeah,
right?
or it could be very high tech eye gaze systems for people who might not be able to point to information that's on a board, but you can put some of that information, whether it's letters that can get spelled out through eye gaze, so very high level sophisticated technologies. I think there's a lot of apps, and Judy could probably explain any of the apps you might use on your phone. There's many apps specific to aphasia and other communication difficulties. I think the double-edged sword I was referring to is, for example, when we're talking in health information exchange, for example, I think patient portals, that type of technology on a computer can be very challenging. I've had patients tell me to just get into access all of the information that's in a patient portal and communicating through technology that way, because it's just a lot to look at, or there's a lot of different buttons to navigate. So I think there's a double-edged sword. You need to be able to also access some of the technology and have internet capabilities for that as well.
Judy, from your perspective, what about the role of technology in communication?
Well, the wonderful thing, I remember one of the first ones, because I had a really hard time getting my writing back, to be able to write, and those non-function words would drive me crazy. I couldn't find them to understand, in the sense of I may be able to say it, I could say it, but I couldn't write it.
You mean you couldn't put pen to paper? Is that what you mean?
Well, actually, I'm actually on the computer. Well, actually, both ways.
And spelling?
Yeah, but spelling was a real problem too. But there was a program actually on the computer that would give me choices, like when I'd get to that, as I said, non-functioning. You know what I mean, like on, or those words, the, or those little words sometimes. Which it would stumble you up.
Really? The little words?
Yeah,
okay.
The little ones. And Nita, could you expand to that?
Yeah, so sometimes those small words, those we call them functor words sometimes.
What do you call them?
Connector words, functor.
Okay.
But those connector words, like in, on, prepositions, they're really hard, especially in writing. And so one of the types of technology that Judy was referring to is something called word prediction software. Maybe she would start to type her thought, or sometimes you could even speak into, for people who have a harder time writing, but maybe they can speak into the technology, and the technology will start to write what they say.
That's interesting. I'm just fascinated. I'd never heard this about those connector words. I think of nouns, and nouns are things. You might have pictures of things, or those are words maybe you can grasp, or actions are verbs. But I hadn't thought about those squishy ones in between there.
Yeah, because they don't always have as much meaning. The nouns tend to stay, right, Judy?
Yes, exactly. And that's where I could find those, but I couldn't find those little words to be able to write. It was very, very frustrating. And like Anita said, one of the best things is being able to have dictation on your computer now. Because when I'm typewriting and kind of lost or having a hard time with it, I will put that on to finish what I'm saying, and it types it for me. I always have to edit it because it isn't perfect, but it just helps me get through, so I'm not spending so much time writing up now.
Thank you both. I'm already learning so much about this. So podcast is called Health Literacy Out Loud. It's all about communicating health information in ways that patients and the public can understand. I'd love to hear from your perspectives. How can all of us help? And when I talk about us, I mean the listeners of Health Literacy Out Loud. We might be clinicians, we might be in public health, we might be at community agencies, or we might ourselves have some communication disorders or care for or about someone who has it. So I look to you for some tips and strategies about how we can each help in this situation.
I just wanted to kind of preface by saying, as you can imagine, like the difficulties that either Judy has shared or I've described at any age, like they can make it really challenging to communicate in health settings, especially because I would love if we could all just think about the context first, often of health settings. Like time is often limited, words are really complex, emotions can run high. And often in those environments, in those health environments, the necessary strategies that Judy has described, they're not often there, or we just haven't modified the environment. So yes, some of the tips I want to discuss are often just kind of taking time, related to time, which is often a commodity, especially in health settings. But I think starting just really my first clue or first suggestion is to ask. Ask. If nothing else, ask the person about their communication preferences,
Okay.
the strategies that they use, and any accommodations that you might be able to put in place before care begins or before any type of, health class begins, programming. If you could be proactive and ask a person if you happen to know that the person has a communication disability and they're coming into your program or they're coming in for a visit, just to ask them how they like to communicate, what strategies they like to use, what would be helpful in terms of making sure they're understanding the information. And you want to think about all the touch points of health communication. It's not just that one-on-one direct conversation that you're having in a health interaction. It might be, what is the access to the signage in your building or the digital information, like we talked about technology online? Can someone access the portal? Are they able to make appointments by phone or online? When you're just saying, oh, you can follow up and make your appointment online. Well, that might be challenging for someone with a communication.
So if someone doesn't ask, how can someone say, I don't want to get on the portal? Or is that an embarrassing conversation to have when the professional will be saying, I wonder if I can ask how she likes to get information, or is that a bad question? Or the librarian or the community agency. Is that an okay conversation for the professional to be asking? Is it okay for the person with a communication disorder to be telling and saying, you know what, I like information this way, but not that way?
You know what? I would love if somebody asked me that.
Oh, okay.
I would love it. It is wonderful. I mean, I am a very big advocate for myself, but lots of people aren't. And, I go in, even when I go in to see people that I know that I have aphasia, I remind them about that. And it's real important that they understand so they can slow down. I am a big writer. Please write it down for me. New information. You can't just throw it at me and I'm going to capture it. I need those things written down. Now, if they go to my chart and they say it in there, I can get it because now I've got used to my chart and I have the app. I've made
Okay.
it easy
Good.
things for me, but I want to walk out of there actually with stuff written down, to be
Good.
honest with you.
Thank you. And again, put it in context of our podcast conversation. The three of us talked ahead of time. We had a planning call and we talked about how we were going to communicate in between the planning call and the recording and who was going to do what. And you made it very clear you wanted it written down. And so we had our own system. So thank you. Thank you. We have just a few moments here left on this podcast. What other tips or strategies would you like listeners to know?
I would love the people to know that looking at me, not my spouse all the time, or caregiver, if I may.
Okay.
Or another thing is, like the time sometimes when you go in, they're typing notes while you're saying things. And I need to be able to see people's mouths and their eyes. It helps me to communicate. And I have there was a friend of mine that went to a doctor's and he wasn't doing that. And she kind of called him out on it. And basically she said, I need your attention, not you writing notes. And he did it. And, I would love just to say this because the next time she saw him, he said, what you told me the last time you were here made me a better physician.
Oh, Judy, I'm getting goosebumps hearing that. Thank you. Thank you. I'm also hearing, and you talked about this, you said you are a good advocate. I can hear that in all you're doing to not only speak up for your own need. That's hard to speak up for your own needs, especially when you're in a kind of scary, uncomfortable health situation. Thank you. And thank you for sharing that story. Adena, from the ASHA perspective, I think, is there some work going on to help professionals? We can't get to all these tips and strategies, but give some high points and how can people be learning more about it?
Absolutely. So, at ASHA, we have a vision statement that I think speaks well to this conversation. Our vision statement is making effective communication a human right, accessible
Right. Okay.
accessible and achievable for all. And so we recently, as part of this vision, and specifically for healthcare and public health spaces, ASHA recently launched this communication access initiative. And we have a tagline, Better Health Starts with Effective Communication. While we know that communication access needs are individual to each person and situation, kind of like Judy explained, some of the strategies that work well for her might not be what another person with a communication difficulty uses. But we do recognize at ASHA that there are some core principles that can help everyone improve effective communication access. And so our communication access initiative, presents these 6 core principles in an acronym format that, not ironically, spells out the word access.
The first letter of each word. Tell us real quickly what those are.
Each letter in access represents a key strategy. So the A is what we were talking about. You'll hear repeated themes from Judy and I. The A is to ask about communication preferences, strategies, and accommodations before care begins. The first C is to communicate directly with the person unless otherwise specified. So that's also something Judy shared about. You want to be looked at and respected rather than looking past the person and interacting with their care partner. The second C is to confirm understanding of information given and received. So that's similar to some of the teach back principles, but it's also, just making sure that you don't want to pretend to understand if you're not getting what the person with the communication disability is trying to share with you. If you're not understanding, let them know. You may need to reword, so saying things like, I'm sorry, I don't think I understood you. Maybe we can explain this in a different way.
Okay.
And the E is to eliminate environmental distractions and give your full attention. Again, something else Judy mentioned, make sure that you're looking and interacting directly with the person rather than having your back turned away at the computer. S is for slowing down to allow time for processing information and responding. So again, just taking time. We know time is a commodity. But we know accessible communication takes time, it takes patience, and that's something that people with communication disabilities really need. And then the final S, again, which you've heard, is for support interactions using all different communication methods. So like Judy mentioned, it could be gestures, it might be writing things down, it could be drawing pictures. It could be sharing photographs. Some people prefer photographs. It could be communication boards or some of the assistive technology we talked about. So those are our 6 access principles.
Thank you. So just how can people get a hold of this? I know ASHA has more information.
Absolutely. The simplest thing is to go to our website, which is www.asha.org. So that's www.asha.org.
And we will have that on your Health Literacy Out Loud webpage. Thank you. It sounds like this really is health literacy in action. I'm going to put a pause in our conversation because we have shared what communication disabilities are, what it's like from, perspective of a therapist working in it, what it's like from perspective of a person being part of this, and all your tips and strategies. I am just so appreciative of our 3-way conversation on health literacy out loud. Adena, thank you. Thank you for all you are doing at the professional end. Judy, my deep appreciation for you for all you've done and your willingness to share and teach. Thank you so much for being guests on Health Literacy Out Loud.
Thank you so much for having us, I think, and giving us this platform. It's such an important conversation.
Absolutely. Thank you. Thank you so much, Helen.
As we just heard from Adena Dacy and Judy Crane, it is so important to think of communication, the disabilities that make communication hard, and the strategies that make it somewhat easier. But communicating effectively is not always easy. For help clearly communicating your health message, take a look at my book, Health Literacy from A to Z. Feel free to also explore my website, healthliteracy.com, or contact me directly at helen@healthliteracy.com. New Health Literacy Out Loud interviews come out the first of every month. Get them all for free by subscribing at healthliteracyoutloud.com or wherever you get your podcasts. Please help spread the word about health literacy out loud. Together, let's tell the whole world why health literacy matters. Until next time, I'm Helen Osborne.